Day 1 of withdrawal of all services by the striking Ghana Registered Nurses and Midwives Association is severely impacting healthcare delivery across the country. A visit to the Adabraka Polyclinic on Monday morning revealed a virtually empty facility from the outpatients department to the various wards. As of 9 a.m., when the news team arrived at the facility, the emergency and resuscitation unit, as well as the female ward, were already locked, while the male ward was empty, with staff getting ready to lock up the place. This is the current situation at the male ward of the Adabraka Polyclinic. There are about 7 beds here, and they are all empty. There's no admissions taking place now because the nurses and the midwives from today are starting the withdrawal of all services. And this is not the only place, the only ward that is empty. The female ward, as we speak, it is locked, as well as other wards. And some of the few staff that we met here say they were on the night shifts, and this morning the nurses and midwives who are supposed to come and replace them are not working, and so they are actually waiting for us to leave for them to also lock up the place. According to the facilities management, who spoke off camera, only 3 nurses are available taking care of the 7 units, including OPD, emergency, male, female, children, antenatal, and labor wards, instead of the 30 to 40 nurses that cover each shift across the facility. The facility has no choice than to refer cases to the private facility, and admissions have been halted. But the impact is biting harder on these patients.
I don't know, like I won't come. So like not you said so, like I'll be sitting here, the 500, the 50 Ghana that I pay is all what I have with me. Like I won't pay, I'll keep it for myself. Then the time they will start work or they will resume, then I'll find other money I come. But now I've given them my money. Even transportation, I don't have it.
I've been here for about 2 hours now. The patient, actually, the place is very boring. So they are saying that they are on strike, but they are saying maybe they will see how they can try and help us. So as you see, they are entering here. They say we should come and wait here small, but the nurses at the OPD have gone on strike. So we are waiting to see.
The situation was no different at the Greater Accra Regional Hospital. The tertiary hospital, which is always flooded with patients, was visibly empty, with some units also locked. Some doctors had to step in to take up the role of nurses by checking the vitals of the patients before they could attend to the few patients here. These patients being wheeled away could not help but cry. The once vibrant emergency unit here at the Greater Accra Regional Hospital was no different.
On a regular day, the whole place would have been filled with patients, but when you walk in, today is a Monday, the seats are empty. The doctors are doing their best, but the workload has now become too much for them. So we are pleading that the two parties will come together and have an agreement so we can have our nurses back on duty.
The nationwide strike by the Ghana Registered Nurses and Midwives Association continues unabated, plunging the healthcare sector into a deeper crisis, as the association insists they will not call off the strike until their employer implements their collective agreement of July 2024. The industrial action, which commenced on 2nd June, followed by withdrawal of OPD services on June 4th, and later withdrew all services effective Monday, June 9, 2025, over 300 public hospitals and clinics across the country near standstill, with thousands of patients stranded. Evelyn Aoba Edu reporting for GH1 News.